Dr. Nomonde Nolutshungu, thank you so much for speaking with us here on SABC News. We appreciate it.
Thank you, Sherwin. Thank you for inviting us.
I think let's start with your role at the South African Embassy as Health Attaché at a time of a global pandemic, and while based in a country that is still by and large regarded as one of the epicenters in the world. What does your work entail as this liaison between Pretoria and Washington amidst this COVID-19 pandemic?
Showing the formal relations, bilateral relations between South Africa and the US in the current dispensation actually started in the early 2000s with a meeting between President Mbeki and Vice President Al Gore here. And that was where all the strategic priorities and the collaboration areas between the two countries were defined. And health was a big part of that. At that time, it was mainly around improving health systems, and we were beginning to see challenges related to HIV. Of course, it has evolved since, as you mentioned, to this point where we find ourselves at the center of this pandemic. When it started early in January, I was just coming back home from a holiday, and there was this news from the WHO and everywhere about what was happening in Wuhan. And we had to start moving things within the mission, but also between in the bilateral relations with the US. There was nothing much happening at the US at the time when it started, but things just went on in a accelerated fashion in the US. We had to watch what was happening here, watch what the CDC is doing, watch what the WHO is saying, how they're managing in China, give evidence and information back home to make people aware of what was going on, even as Minister Mkhize had or was already on it, working with the WHO at the time. So my work related mainly to communicating with the CDC, with the WHO here, State Department, see what is happening in Congress, and watch how this government was responding to it.
So South Africa, right, is now regarded as the epicenter in Africa, the US or perhaps Brazil, the epicenter globally. Talk about the lessons one might have observed, the collaborations that have been undertaken. You mentioned, watching very closely what Congress does, the CDC, and talk about that undertaking between Pretoria and Washington.
Fortunately, Sherwin, South Africa is the US actually has a soft spot for our country. They often say that it looks like we're punching below our where we could be, and they wanted to assist us doing so. And this kind of relationship started back before apartheid with the anti-apartheid movement and all of those things that had happened up to this point. So everyone bilateral across the aisle in Congress actually has a soft spot for South Africa. Even as there were discussions about reducing funding for the PEPFAR program, which in fact was started by a Republican president, President Bush, that couldn't go ahead because it has bilateral support for South Africa. And now with the advent of this pandemic, PEPFAR has actually increased funding to South Africa to make sure that all of the things that we need, you probably have seen the support with ventilators, now with oxygen, and with the new medication that is coming up, remdesivir. South Africa is the first country to have a discussion with Gilead Sciences about how to make it available and accessible to South Africa. That's the kind of work that we do from this end in that collaboration.
You'd agree, though, that you do have this observation perch being based in the United States, and that being able to really watch how this virus, this pandemic, has transformed this country in so many ways. Some talk about the intersection between politics, the socio-economic aspect, and the science and data that most health experts agree really needs to drive any response to this pandemic. What can you say as a diplomat about how those worlds have clashed in the United States?
Having been through the center, or actually at the center of the public health response to the HIV pandemic or epidemic in South Africa, politics were at the center of that. And I was coming from a social work background, coming from a public health background, understanding the dynamics that are in the function of the spread of the virus and development of disease. One had to focus on what works best, draw elements from all of those aspects. To talk to the politicians, make sure they understand the nature and the extent of the problem and what practical solutions there are, and be the source of information that they can rely on to make those kinds of decisions. But also talk to communities and to leaders in community that are influential in different wide-ranging communities, in fact, and work with activists. Sometimes it was, if you were seen working with the treatment action campaign, it was like you're selling out or something like that, but you talk to them and they tend to support the work that you do. So I think even here, what we see coming through is, the example of Ambassador Bex at the head of President Trump's commission dealing with the pandemic. You can see her straddling between the science and the politics of it, but at the same time managing.
Deborah Birx is having a tough time, let's put it frankly.
Well, I can relate to that because I've been through a situation like that too. But because you understand that this thing needs to be done. Yeah, some will beat you for having sided with this side and that side, but you focus on getting things done on the ground. If you look at what Governor Cuomo says sometimes, if not often, he will say, Dr. Beck says, if 90% of New Yorkers wear masks, we will reduce the spread by this much. Never mind that people are saying Dr. Bex is now leaning towards President Trump and all that. But the lesson or the teachings or the message is going through to the practical solutions to these things. It's a matter of managing all of that.
But you would agree, though, that politics has had life and death consequences in the United States. Reopening too soon in some states has had real life consequences where some states have had to pull back. And you mentioned Andrew Cuomo sort of pointing his finger at what was going on in Florida, in Texas, and Arizona, saying we've been through that and we warned you about that. So the notion of reopening too quickly, given the need for it, right? The socioeconomic impacts that this virus is having, there lies the complication. What are you telling Pretoria?
Politicians, Sherwin, will always be politicians. Our role as public health specialists is to make sure that we deal with the real issues. Try and get the politicians to understand, pushing with scientists and with workers on the ground to do what needs to be done. Inspire the doctors, inspire the nurses, inspire the community health workers to push the work. Politicians can manage politics. I remember when we tried to introduce antiretroviral therapy. It was in 2003, 2004. It was elections time in South Africa. And I was working in the Gauteng province at the time. Premier at the time was Premier Mbazima Shilowa. Yes, because he came from COSATU and COSATU was pushing for the introduction of ARVs. He said to us, to me specifically in the department, doctor, be a public health specialist, I'll handle the politics. So they had their own fight in the ANC, but because he said, hey, do what you need to do, I'll handle the politics. Politics will always be politics, but public health specialists, we have a responsibility to do what needs to be done.
So public health experts have a responsibility?
Yes.
But also government officials have a responsibility. Politicians have a responsibility. You know, in the United States now, I think they're discussing the fifth economic stimulus bill that might be passed in response to this pandemic. Can you talk about the role of the state and really the disparity between the developed world and developing countries like South Africa that don't have the financial capacity or the deep pockets that countries like the United States have?
The answer is what you're actually saying, Sherwin, is the level of development and the capacity economically and financially of all of these countries to deal with a pandemic like this, let alone on the economic aspect of it, just the mere health systems. That basically has got an impact, as we know, on the economy of all of the countries that themselves are not as developed as the United States, as we find. The United States has the capacity to call Congress and say, we need another stimulus, we need another stimulus. They can do that. Can we? The answer is obviously no. We're not in that same position. So this virus has highlighted those disparities of development, particularly economic development between the North, the West, and the South, and so on. So we need to do a lot of work to ensure that there is economic development as we deal with the pandemic as well.
So that we can then shore up capacity for the next crisis, right, Doc? I suppose that's the point. One of the big debates...
And in fact, if I may, Sherwin, there will sure be another pandemic.
Yeah.
There will sure be another pandemic. So now the lesson for me, the biggest lesson of this, we've always had it as theory that we're expecting a pandemic soon. It's now here. It's real. We're going through it. So the biggest lesson is, how do we prepare for the next one? Because it's going to come. And how do these come along? Do we understand how they come along? And can we close that particular tab, but prepare and build resilient countries in terms of economies and social development?
Couple more questions for you, Doc. One of the big debates now between both countries, USA, South Africa, and other places, is the reopening of schools. What are you hearing in terms of the debate in the United States, and how is that informing your discussions with your South African counterparts back home?
Well, in terms of public health, particularly public health interventions, social distancing, all of the advice that's coming from the WHO is applicable. And in all of those advices, they actually do work, as we have seen in the work that has been done in New York, in the New York State, for instance. So when politics come into the equation, things don't actually, we don't do well, that's the experience that we find in the other states. Now they're going back to lockdown, and we don't want to get into that situation in South Africa. And fortunately, all political parties in South Africa are on the same page on this. If you look at what is happening in the Western Cape with Premier Winde, they did what the WHO is actually recommending should be done, and they agree with the policies of the national department is led by Minister Mkhize. So if we're able to take politics out of this and implement a public health strategy, stick to science, whilst we cushion the economy at the same time, that's the reasonable thing to do. As that's the lesson that we're finding from what has happened in some states in the United States.
What about testing, Doc? What about testing and broad-based testing, right? I mean, the one argument you're hearing is the only way you can really open up economies in a sustainable way, open up schools in a sustainable way, open up churches in a sustainable way, is really to understand where the virus is. And by to do that, you need to have broad-based testing for everybody that needs a test. That costs money. Is that even plausible in the South African context?
Two important things about testing, Sherwin. You need to know where the virus is, and that, to me, importantly, is antibody testing, is the surveillance, is the sentinel surveillance, targeted sentinel surveillance, particularly in your identified hotspots where you have seen most of the cases coming from, and you can spread it to other communities. You see the road that the virus is traveling. We don't have enough antibody testing at this point. Even in the early times when the Eastern Cape, where the hotspots were identified to be Nelson Mandela Bay and Buffalo City, I was thinking already about sentinel surveillance, but we didn't have antibody testing at that time. I think that is critical. But also, as we open economies now, antigen testing to find your active cases, that is critical. That is critical, particularly for those with symptoms and those who come from the hotspots. So testing, it cannot be overstated. I wish that all of the companies that are doing developing these tests could have built up more capacity to make these tests available. That's a critical step in the management of this pandemic.
I want to wrap this conversation by looking at vaccines. We've seen news today that the United States has tapped Pfizer and a German biotech company to produce 100 million doses of a corona vaccine to the tune of $1.95 billion. What do you make of the trajectory we're on in terms of the vaccine? Some say this is moving at a record pace. It's too quick. You cannot possibly deal with efficacy and safety in such a short period. What can you say?
We cannot actually rely on the time frames of previous projects for vaccine development with what is happening with the COVID-19 virus now. We need it yesterday, and we needed those vaccines to attack the infection from disparate aspects of the pathogenesis of the virus itself, the immune system, different elements. And you find most of these projects are actually, that's what they are doing. But in doing so, we cannot let down guard on the quality of the work that needs to be done, on the ethics of it, on the biological plausibility of all of that and everything. All of it needs to be done, but accelerated. So I have faith in all of the work that is being done on vaccines, that is being carried out in the most responsible way. Necessarily, it has to go fast. We need it. Herd immunity is not going to be enough to protect people from infection, Sherwin. And the economies are falling, and that we don't really need to get to a terrible point. So I think it's necessary that it goes as fast as possible. And I'm glad to see that South Africa is participating in a meaningful way in this. We have actually amazing research capacity in the country. What we got from HIV and the expertise that was developed from HIV, we're using it now to try and fight, to engage this fight on COVID. And I think that the leadership politically is on it.
Dr. Nomonde Nolutshungu, thank you so very much for having this conversation with me.
Thank you, Sherwin. One more thing I'd like to say. I'm sad to just say that I'm mourning, even as I do this interview. I'm in the middle of mourning the passing of my nephew, Kaunda Ntuja. He was the closer commentator on rugby. The whole country now is mourning his passing after he had just buried his dad about a week ago. That's my sister's husband. And I strongly suspect it's all the stress of COVID on all of them. May their souls rest in eternal peace. But thank you for having us for the interview.
And please
all of South Africa in dealing with it.
Please accept our condolences. Everybody really is affected by this, and I really do appreciate this conversation. Dr. Nomonde Nolutshungu, Health Attaché based at the South African Embassy to the United States in Washington, D.C., a medical doctor with expertise in infectious diseases, epidemiology, biostatics, and public health.
Thank you, sir.